Shoulder pain and stiffness is common among any age group. What causes shoulder pain? What causes stiffness? And how one can manage the pain and stiffness? Those are the things we are going to see in this video today. Let's dive into the video. Hi guys, welcome to Karthik Physio YouTube channel. This is Karthik, Physiotherapist from Canada. Sorry, I wasn't able to post videos on a regular basis in the past year or so because of various personal reasons. I'll try to keep you educated regarding physiotherapy and whatever the therapeutic approach is possible in the modern era. What causes shoulder pain? So before we address the reason or causes of the pain, it's important to understand the shoulder joint. The shoulder joint is a less stable joint or more functional joint. For example, the comparable joint is the hip joint. The hip joint is more stable because it's supported well by your pelvic bone and other bones and then muscles. But here the shoulder doesn't have any huge support like a hip joint, but it's more functional. So therefore, it's more vulnerable for injuries. And then the mechanics of the shoulder can be altered, which can put stress on the different parts of the shoulder, therefore can cause pain and stiffness. If somebody is not able to lift their arm up, the possible reason could be the shoulder is not, the bone humerus is not rotating properly to the side. Same goes for bringing your arm out at the side. And if you are trying to lift your arm at the side, same thing applies. You need a good rotation of your shoulder. So when that rotation is not happening, and when the shoulder itself trying to go up, what happens is there are so many trick movements happening which involves your shoulder blade a whole lot. So it's very important for the rotation component to be addressed to improve the shoulder range of motion. So how do we know the shoulder is working normally? One should be able to lift their arm up. They should be able to reach the other shoulder, and they should be able to reach under the lower back on the opposite side. But injury, a ligament injury, a soft tissue injury, a muscular imbalance, there can be an overriding of major muscle group which can compensate the work of the minor muscle group. Bottom line, there is a muscular imbalance so that the stability of the shoulder is affected. So to improve the range of motion overall, if it is not an acute pain, then you can work on a chronic pain under stiffness with the techniques which we are going to see shortly. So if you touch on the shoulder, if you feel there is warmth, there is redness, there is swelling, and the pain is sharp. So for those kind of acute pain, I would stay away from any kind of heat. But that's a common mistake people do. They try to put the hot packs on or heating pads or whatever they have handy at their home, and then try to get rid of the pain, but end up with aggravating the inflammation and pain together. So for the first 72 hours, any joint, any acute injury, acute pain, I would put the ice on. The general guideline would be 15 minutes each time. You can go for up to 3-4 times a day, but with a minimum duration of 3 hours in between one session and the second session. So I would focus on controlling the pain first. And if you think the injury is too hard to bear, then you should seek medical attention. If you know it is like a little twinge, but your shoulder is kind of crying out with pain, then you can control the pain with this ice therapy. Let's go to the next one. A chronic pain or stiffness. For example, if somebody have a frozen shoulder is nothing but a tight capsule. The capsule is a covering of the joint. So that restricts the motion. So they cannot put their shirt on, they cannot reach out on the top of the closet, or so many activities which you can put in one word, any overhead activity. This can be caused by frozen shoulder or rotator cuff injury or rotator cuff degeneration. Even a gym goer can hurt his shoulder, but some of the muscles can go for inflammation and therefore refuse to move. So this kind of stiffness and pain can be relieved by 2 simple stretches and 1 movement. The first thing is I would focus on the movement, which is rotation. So how to do that? It's a simple thing. All you have to do is keep your hand rotate facing the palm up. So now you can lift your arm up. You can go as much as you can, and then you want to repeat that movement at least times 10. Same thing on the side. You can put your hand opening the palm facing up, you can go on the side. But if you go with your palm facing down, it's going to stop here. That's a normal movement because the top of the shoulder, the bone right here, is going to stop the movement of the bone humerus. This is a humerus bone. I think you all know about it. So the first technique I would do, if the pain eases on that, well and good, because there is a structure which is pinched in. You just relieve that pressure and then you are able to lift your arm up better. So I would try this movement as many times as possible. This is the first movement. And the stretch, before you stretch, you want to know how much limitation you have. You can lie down on your back with someone help you with your arm resting up to the elbow on the couch, and then bend your elbow. Ask the person who is helping you to rotate your arm at the side. So that means they are passively rotating your arm, and then ask them to hold at that point to the end. Or it starts to hurt, or if you feel the tension building up, you can tell them to stop right there. Then let them keep their hand right here, and then you take your hand off and then try again to reach the same spot. If you cannot achieve the same range actively, that means you have an ongoing restriction on your shoulder because you're not able to achieve the same movement which is done by somebody passively. The next step would be performing stretching on those muscles which are tight. So I'm going to show you the two stretches which can be done within 1 minute time. The first stretch. So you want to choose a door, a stable door or a door frame or doorway. So all you have to do is, if you have a restriction, if you can lift your arm up. So you can keep your arm at the side, just bend your elbow, make sure the palm is facing forward, and you can put it here, right here. And the only thing is, let's say if you have a restriction, you can't turn all the way facing forward. So wherever you feel the stiffness, you want to stop, and then you want to feel the tension on that without causing any pain. So if you have pain like this range, so you want to loosen up a little bit and stop right before the pain starts. And hold that position for 30 seconds and then repeat twice. So that's a 1 minute stretch altogether. And once you are able to come up, so you want to travel up with your hand, sliding your hand up. And then you want to make sure your elbow on the forearm is resting well on the door or whatever the surface you use to stabilize your arm. So in this position, you want to hold it. Make sure you're not shrugging your shoulder or not bending forward, not in an off position where you can get an effective stretch. Same thing you want to do like 30-second stretch. So once you reach this level, so you're going to hold this position for 30 seconds twice. So when you take your hand off, you don't want to drop it off like that. You want to step away and pull your arm up. In case if you have too much pain, you want to go gentle with your arm. For the second stretch, I'm going to choose a wall, and then what it's intended to do is to stretch the muscles right here and the capsule behind. I'm going to show it on my right arm. So for this, you want to keep your thumb facing up and your forearm in this position, not facing up, not facing down. I want to keep it in the middle. So right here, with your elbow and the forearm resting on the wall, with your hand here, you want to focus on your elbow. Just slide your elbow, and if needed, you can go close to the wall and then try to push it as much as possible higher and higher. You don't want to do any jerky movements, or you want to push too much through the pain. If it starts to hurt, then you want to stop, as we did in the last stretch. Same thing, you want to hold it for 30 seconds times 2. So after you're done with this, you want to step out with your hand here, and in case if you have too much pain or stiffness or anything which is causing you too much discomfort, you want to support with the other hand and bring it out. So these two stretches can help improve the range of motion. Perform the stretches, make sure you're breathing normally, and you're not pushing through pain, and please stop before you feel the pain. If the pain is too acute and if you're not sure what's going on in your shoulder, please seek medical attention. Talk to your physiotherapist or your doctor. These stretches and the information I shared about are general guidelines only, and it's not meant to replace any expert medical opinion or an in-person assessment and treatment by the physiotherapist. And therefore, it's not one size fit for all. The next video we'll talk about some strengthening exercises for the shoulder, because so many exercises which are performed in the gym or when people do any chores in a different way to go for long-standing rotator cuff injuries. The rehab would be complete for an injured shoulder. When the pain is treated, the tight structures are relieved and the weaker structures are strengthened. So the next part would be strengthening. That's the one exactly I'm going to address. How to improve your shoulder health overall after you come out of the pain and stiffness. Until then, bye from you guys. Karthik Physio YouTube channel. Thanks for watching.